Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, and thanks for joining us on this quick kick. If you've picked this particular topic, I'm guessing that you've got some terrible, difficult pain in your pelvis. And one of the conditions that can cause this is pelvic girdle pain. Now, that's pretty much an umbrella term, but it can mean any pain in either the back part of your pelvis, around your SI joint, your sacroiliac joint, or in your pubic symphysis, which is right between where the 2 bones of the pelvis meet, just around your vagina. I totally know how this feels. So in my 4th pregnancy, I had terrible pelvic girdle pain, and it required a lot of treatment to make me feel like I could manage in that pregnancy. It's a pain that feels constant, so I'm guessing you've picked this up because this is your issue today. We had an episode a little while ago with the amazing Kath Baquie. She is a women's health physiotherapist, and she is the full bottle on pelvic girdle pain. And I encourage you to go and listen to the full episode if this is your first time you're hearing about pain in your pelvis. But for those that have gone, oh my God, I've got that. What do I do? How do I make myself feel better? How do I treat it? How do I prevent it? This is a little quick kick for you, so let's get on to it.
Hi there, it's Ashani Dante here.
And me, Dr. Anastasia Horonis.
We are the hosts of But Are You Happy, your favourite self-development podcast.
Tune in this Saturday to find out how to spot the narcissist in your life and how to manage them.
But Are You Happy? New eps drop every Saturday morning, wherever you get your podcasts.
Is there a common stage of pregnancy for pelvic girdle pain to be diagnosed?
Due to hormonal changes and all the different changes that are happening in the body, it is commonly diagnosed in that 2nd trimester and approaching that 3rd trimester. But having said that, I do still have women who are 34 weeks that come and see me, but generally they've had it grumbling along for quite a few weeks before they come to see me. So I do say it probably does hit in the 2nd trimester, and sometimes it actually does improve. If you can get onto it sooner rather than later, I'm all for being so proactive and trying to nip it in the bud as soon as possible to stop it lingering as much as possible.
All right, well, let's go down that path then. What can somebody do to prevent pelvic girdle pain? We've talked about sleeping.
Yep. So look, if they're getting pain when they're sleeping, often that's one of the first warning signs, I think. So like I often ask the question, have you got any pain in your pelvis? And they say, oh no, I feel fine during the day, but I am achy at nighttime. So if you're achy at nighttime, I would be thinking, okay, I need to perhaps think about modifying a few things now to try to nip that in the bud. So a few things we can do is, as we said, let's get on to as many strategies as possible to try to stop lifting. So whether or not that's at work or your toddler, of course, there'll be times you need to lift your toddler. I get it. I've got 3 kids. But, even if you can reduce it 20%, 30%, 50%, that's amazing. And then the other thing would be to look at how much you're walking. So walking, it's considered a really great exercise for pregnancy. It's low impact, it's free, it's easy to do, it's great. But unfortunately, if you have pelvic girdle pain, it might irritate your pelvic joints. There's a lot of shearing forces that are thought to happen with walking. So I don't say to my mum, stop walking for the rest of your pregnancy, but I do say, look, let's trial really pulling back on your walks for 5 days or so, and we'll replace that with something else. But really, let's try to stop any aggravating factors. Let's stop the lifting, let's stop the walking, and let's instead replace that with rest. So periods of horizontal rest through the day can be amazing. It's thought to have a bit of an inflammatory component to it, pelvic girdle pain, so inflammation.
Yeah.
So if we can settle that inflammation down, it's thought to really help. And this is what I find works best for my clients and members. So throughout the day, let's start proactively icing to help reduce that inflammation.
And so where would you actually be putting the ice?
Good question. If you've got pain at the front, I'd be putting it on the pubic symphysis, so that bony bit right at the bottom, at the front of your pelvis. If you've got pain at the back, I'd be putting it on where it's sore, so around the SIJ joint. So if you can ice for 20 minutes or so every few hours throughout the day, and when you're icing, you're lying down to ice, so it's horizontal rest, so you're removing gravitational forces. Icing combined with horizontal rest, combined with no lifting and no walking, I think those 4 things can work wonders, and I've had such positive feedback. So my tip for anyone, if you've got a bit of a grumbling niggle, try just a few solid days. I know it's hard, but maybe over the weekend when you've got a bit of extra help perhaps, or you don't have to be at work, and trial it. There's no harm done, right?
Yeah.
And it might really help to nip it in the bud so that then you can get back to gradually doing your normal things.
And what would people be replacing their walking with? I know it's only just a short period of time, but, if it's a long term over their pregnancy.
Yeah, as you said, if it's just a few days, look, let's just rest. Let's cut it out. But if it is going to be longer than a week or a few weeks, there's a few different options. Water is amazing. So hopping in the water and walking in the water even. By walking in the water, you could have 70% of your body weight supported. So only 30% of your body weight's going through your pelvis. So it could be pain-free. It's not putting those pressures through your pelvis. There's something great if you're based in Melbourne, and there might be different ones around the place, but something called Aquamums, a really great program. I used to be an Aquamums instructor back in my day, and nice. It was lovely. And I used to do it as well when I was pregnant. Water is a really lovely place to exercise. But then there's also pelvic girdle pain-friendly workouts available, and that's what I provide inside Fitness Mama, a whole module on pelvic girdle pain-friendly workouts. So there's a lot of different exercises that can be rejuvenating, that can help you feel good afterwards, that aren't putting the stresses and strains on your body. So there's a lot of different options, but asking around at your local clinics if they've got any pregnancy-friendly Pilates available or an online program that has pelvic girdle pain-friendly options. So there are a few different options.
Thanks for joining us on this quick kick. Now, one thing I wanted to add as my tip is if you've got pelvic girdle pain, and that is how we push our shopping trolleys or cart. Now, I know this is very mundane, but I'm guessing we're all going to the grocery store and we're all using those shopping trolleys, and we all know they have a mind of their own, don't they? So my big suggestion is, instead of holding onto the handles and pushing as normal, swing the trolley onto the side and push with one hand on either end of the trolley. This helps to stop the shearing forces that happen in your pelvis when you're trying to control a trolley that has a mind of its own. My other big tip is what our physio at our clinic calls safe transfers. So this is how you get up out of bed, how you sit on a chair, how you get out of that chair, or even how you pick up your toddler. All of these things are really important to minimise the pain of pelvic girdle pain. So if you're sitting down on a low couch, just choose to sit on the end of the couch where the arm is, so you can use the side of the couch to help propel yourself up. Or when you're getting out of bed, roll onto your side and then push yourself upright using your hand, so you can eventually swing out of the bed with both feet touching the ground at the same time. Now, I know this is audio and you obviously might need a visual for this, so our physio has put all of this in our pregnancy program. And if you want weekly guidance like this throughout your pregnancy, I highly recommend that you go to our website, which is growmybaby.com.au, and join our program, which actually works out to be about $4.50 a week, to have an obstetrician plus other experts in your pocket during your pregnancy and postpartum. For those that want a fabulous physio-led exercise program during their pregnancy, I highly encourage you to go to Kath's Pregnancy Pilates online, and she has a discount for all of our listeners. Just put in KICK, all capitals, and you'll get 20% off everything that she's got on her website. So yeah, just jump on there. I'll put the links in the notes for you, and oh my gosh, I know that's a lot of information I've just given. I hope that your journey with pelvic girdle pain goes smoothly and that it isn't too debilitating for you. Know that there's help and there's strategies for you to do, and I hope that this quick kick has given you some of the ideas about where you should go to next. Thanks for listening, everyone. We'll be back in your ears next week. Thank you for all your love in our DMs and our 5-star reviews. We love them so much. And if you feel inclined, just jump on and give us a 5-star review on either Spotify or Apple Podcasts to show us some love. All right, bye for now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.